If you enjoyed this podcast, please consider liking, sharing, and subscribing to the channel. The island that history made Poveglia sits in the southern basin of the Venetian lagoon, about 7 acres of flat land surrounded by open water. From the city, you can see it. But for most of its early history, it was simply there, quiet, unremarkable, and occupied by ordinary people going about ordinary lives. Venetian records mention the island as far back as the 9th century. Farmers worked small plots, fishermen pulled from the lagoon. A church served the community. The island was connected to Venice by trade and governed by the Republic's administration. But it kept its own modest pace, separate from the city by stretches of open water. Venice at this time was one of the most organized states in Europe. Its officials recorded everything: land, taxes, populations, territory. Poveglia appears in those records without drama. Just a place, just a community. Nothing about it suggested what was coming. By the early 14th century, the island was still intact. People were still living there, fishing, farming, trading with the city. Then, in January 1348, ships arrived in Venice harbor, carrying something no one could see. The Black Death had reached the lagoon, and Poveglia would never be the same place again. When the dead outnumbered the living, the number most people cite is 160,000. That is the figure that appears in articles, documentaries, and travel pieces about Poveglia. But no census office produced it. No single archive holds a confirmed tally. The Republic of Venice kept records, but plague logistics did not always allow for careful bookkeeping. Oddies came by barge at night. They were burned when wood was available. When it was not, they went into pits lined with quicklime. What we can confirm is simpler and harder to dismiss. Soil analysis of the island has found that roughly half its composition is ash and human bone. Not metaphor, not legend, physical material. Poveglia was used as a burial site across 4 major Venetian outbreaks: 1348, 1382, 1576, and 1630. Each time, the Republic's response followed the same logic: move the sick and the dead away from the city, contain the threat on water. The island was close enough to reach by boat and far enough to keep danger at a distance. This was public health by necessity, not cruelty, though the result looked much the same. The 1576 outbreak is among the best documented. That year, the painter Titian died of plague. Because of his fame, he received a church burial inside the Frari Basilica. One of the only plague victims in Venice granted that exception. Every other anonymous body went to the Lagoon Islands. Most went to Poveglia. The difference between Titian's grave and theirs was not biology. It was status. That gap between the named and the unnamed is what the island holds. The bones are real. The scale is real. The precise number may never be confirmed, but what sits beneath that soil is not in dispute. The checkpoint at the edge of the world. By 1776, Venice had been running quarantine islands for over 300 years. The word quarantine itself comes from the Venetian quarantina, 40 days, the length of time ships had to wait before anyone could step ashore. The Republic had operated its first formal quarantine station, Lazaretto Vecchio, since 1423. Poveglia's designation that year was not new thinking. It was a system that already worked, applied to a new threat. Ships arriving from Ottoman ports, North Africa, and the Eastern Mediterranean were ordered to anchor off Poveglia's shore. Crews were examined, cargo was pulled out and fumigated with smoke and sulfur. The sick were taken off and separated. Those who died were buried on the island's soil, adding to what was already there. The octagonal watchtower, the Ottagonale, still stands at the island's southern tip. It was built during this period to serve as both a navigation marker and an administrative post. Officials could watch incoming ships from its upper level. It is one of the few structures on Poveglia that remains largely intact today. By the time Napoleon dissolved the Venetian Republic, In 1797, the quarantine station was still running. It passed to French control, then Austrian rule, its function slowly shrinking as plague retreated from European ports. But something else was growing alongside the official records. Lagoon sailors were already talking, lights in windows, sounds from the shore at night, shapes that had no business being there. 5 centuries of death had given the island a reputation that no administrative document could explain away. The Doctor and the Tower. In 1922, the Italian government repurposed Poveglia's old quarantine buildings into a working psychiatric hospital. The structures were already there, solid, walled, and isolated. Workers crossed from the mainland each day to staff it. Patients arrived and did not leave easily. At the center of the island, the old stone campanile stood over everything, visible from the water. The legend attached to this period is well known. A doctor, never named in any document researchers have found, allegedly performed crude operations on patients, lobotomies done without anesthetic, procedures that served no clear medical purpose. The story goes that he lost his mind and fell or jumped from that campanile tower. No Italian record publicly identified so far names this doctor, records an investigation, or documents a death at the tower. That silence is significant. It may mean the story was invented. It may also mean the files simply have not been opened. What is documented is this: Italian psychiatric institutions of that era were genuinely brutal. Franco Basaglia spent years exposing what happened inside them, and his work led directly to a national reform law in 1978. Abuse was real and systemic across Italy. Whether Poveglia shared in that record or exceeded it, the specific evidence has not surfaced. The hospital closed in 1968, the island emptied, and access was quietly cut off. The island, the state sealed shut. When the asylum closed in 1968, Italy's government gave a clear reason for sealing Poveglia. The buildings were unsafe. This was not a lie. The Venice lagoon is brutal on old masonry. Salt air, rising damp, and decades without maintenance had made the hospital complex genuinely dangerous. A responsible government closing a crumbling structure is unremarkable. But researchers and journalists who studied the case noticed something harder to explain. Italy has dozens of abandoned asylums, ruined fortresses, and decayed island sites. Most are loosely managed, fenced, posted with warning signs, occasionally visited by urban explorers without serious consequence. Poveglia was held differently. The prohibition was firmer, more consistent, and more vigorously enforced over a longer period. In 2014, the Italian state tried a different approach. As part of a national program to reduce public debt, it auctioned a 99-year lease on the island. A Venetian civic group called Poveglia per Tutti, Poveglia for All, crowdfunded roughly €400,000 and submitted a bid to keep the island as accessible public space. The state awarded the lease instead to a private developer planning a luxury hotel. Heritage disputes followed. Planning approvals stalled. The project never moved forward. The island sat unchanged. Which leaves one question sitting quietly at the center of all this. When a place remains sealed for decades, through government transitions, failed auctions, and blocked development, at what point does the official reason stop being enough? What the soil remembers. In 2016, archaeologists surveyed Poveglia as part of the development review process. What they found was straightforward. Human remains, lots of them, consistent with exactly what the historical record had already documented. Plague burials, quarantine deaths, bodies committed to the soil across several centuries of epidemic use. The survey confirmed the history. It did not expand it. What archaeology could not do was reach the asylum years. Patient records from the psychiatric facility remain incomplete. No published research has produced findings that either confirm or deny the stories that circulate about what happened inside those walls. The documentation simply stops short. The stories fill the gap. In 2009, the American television show Ghost Adventures filmed an episode on the island. It reached millions of viewers. It also flattened a genuinely complex history into a haunted house narrative, prioritizing drama over the documented record. That episode did more to shape public perception of Poveglia than centuries of actual history had managed. A real story, strange enough on its own terms, became something else entirely. What remains is the island itself. 6 centuries of use as a place to put problems society could not manage. The sick, the dying, the mentally ill, the inconvenient. Then closure. Then silence. The buildings decay. The campanile still stands. The soil holds what it holds. Whether the island is closed to protect visitors or to protect something else, no one has officially said.